Hello, and welcome to this course on abnormal psychology, course number 504. My name is Rocky Garrison, and I am a psychologist and the teacher for this course. Before we get started, make sure that you have read the syllabus and make sure that you've downloaded the one that's here on the website because I just updated it, as well as the online confidentiality, copyright, and attendance policies. There is a place for you to check that you agree to these policies. Also, be sure to post an introduction on the Course Introductions forum and update your profile. By the end of this course, I want you to have a personal working definition of abnormal behavior and be able to recognize it when it is sitting in your consulting room with you. I want to contribute to your skills at inquiring about a person's symptoms and their distress, and I want you to be aware of the breadth of problems that people can have so you can get a complete picture of the psychological functioning of your clients. I want to improve your ability to describe a person's functioning and to conceptualize their distress. I believe this is the foundation of good treatment planning. Recently, I received a referral from a primary care physician. The reason for the referral was insomnia and nightmares. Careful inquiry revealed the rest of the story, a history of childhood sexual abuse that had occurred randomly at night, an hour or two after bedtime, from ages 5 to 9, as well as flashbacks, avoidance of intimacy, hypervigilance, and exaggerated startle response. When I asked why she hadn't told her PCP these symptoms and history, she replied, "Because she didn't ask." My hope is that this course will contribute to you knowing what to ask and what to make of the information you get. We have 9 units together in 4.5 weeks. For each unit, I have recorded 2 talks. One is an overview of the chapter, covering the same material that is in the assignments document. The other video focuses on the diagnoses that are covered in the unit. It goes over the ICD-10 diagnoses that correspond to the DSM categories and reviews the measure or measures that are suggested for the diagnoses by DSM-5. We are going to focus primarily on DSM-5 with some reference to how it is different from DSM-4. We will become familiar with the ICD-10 nosology. We will look at the Level 1 symptom measure and the Level 2 measures that are used for additional assessment and tracking of progress for specific diagnoses. For each unit except the first one, we will look at 1 or more chapters from DSM-5. For each of the 15 DSM chapters we will examine the corresponding ICD-10 diagnosis and coding. 11 of the diagnoses have a corresponding chapter in the textbook for the course, Castagnet and Oltmans. 11 of the diagnoses are included on the Level 1 symptom measure, which is suggested for use by DSM-5, and 11 of the diagnoses we will cover in this course have Level 2 measures that are for additional assessment and tracking of progress in treatment. We will also look at the Disability Assessment Schedule from the World Health Organization, which is suggested for use in DSM-5 as a replacement for Axis-5 from DSM-4. The Global Assessment of Functioning Scale. We will look at several transdiagnostic processes, and we will look at the individual psychology of Alfred Adler. These perspectives do not fit neatly together. As a matter of fact, they often contradict one another. This table is available for you to download, the course overview table. For each unit, it spells out the diagnoses covered, the items on the Level 1 measure that correspond to the diagnosis, tells you whether there is a Level 2 measure for the diagnosis, defines the ICD-10 diagnoses that correspond to the diagnoses covered in the unit, and identifies the individual psychology and transdiagnostic concepts that are covered in each unit. The primary texts for this course are DSM-5 and the textbook Psychopathology from Science to Clinical Practice by Castagnet and Oltmans. If it had been a while since you took a course in abnormal psychology or psychopathology, you may want to pick up a textbook. I recommend Barlow and Durand, 6th edition, which is listed in the optional readings section on the syllabus. We are also using the casebook that goes with this text and a book of cases by Alfred Adler, volume 9 of his collected works. Each unit has one or more articles and one or more optional readings.